Good afternoon, everyone. I hope that you're healthy and coming today to learn something and just tell us what you think after our discussion. Um, I think that you know me right now, and I'm a physician for 20 more years. And, I working in many countries, at least four, even before come to United States. So I really know about the diversity based on, my work and my um, challenging and my education. So usually we need to tell that what we are doing in terms of the research or financial disclose, we could say. And, I'm working with many new knowledge about the genes that we just talk about that how is important, but there are a lot of things before even to know about the genes is the socioeconomic system that we need to talk about. And we really wanted to learn something today, that what we are here and what is really important to know the risk factors for kidney disease and what is the meaning of diversity in the kidney disease. There is a gentleman that I really, when I wanted to say and talk to you guys about that, there is a um, doctor, actually, he's a very well known nephrologist right now in the area of education, Dr. Kevin Tucker. This gentleman is African American. He was born in a very poor socioeconomic system there. And when he talked about his timing of the remembrance of his childhood, he remembered that his grandmom was kidney disease patient. The neighbors, they have a couple of the people that being on dialysis and they have so many problem with, getting to dialysis center. And he raised with all of those things that heard about the kidneys. So this gentleman is on high level of the educational system in Harvard School of Medicine. And he's the one that write this topic about what is behind racial disparities in kidney disease. And he found out a very important type of subjects that, first of all, before 1980s, all the kidney disease patient and population looking together, not like, if there is any difference between the different, racial or sex even, or, the other type of socioeconomics, which is 1980s, is like, few years from now, right? It's not too long. But he found out that people with the African American and low socioeconomic, they have 18 times more than normal other population prone to get the chronic kidney disease. This term is so big, 18 times, compared with like what's the difference between hypertension in African Americans and the other population. This is only 3 times. But why this, if this is all related to hypertension, why this is a big jump for the chronic kidney disease in African American and the other population there? Which he found out a lot of things which we were going to discuss about. I think that I actually wrote the slides there, but I believe that the pictures is working much better for everyone to look at it. So more than 1 in 7 of the patients, not patients of the population, even from our people sitting here, 1 out of 7 they definitely have a chronic kidney disease. And look at here, 14% of US adults are estimated to have a chronic kidney disease. This is in whole population, which means we have 35.5 based on the study done by CDC in 2022. We have 35.5 million population with chronic kidney disease. This is a huge amount. Agree? I think that the computer goes to, which I cannot control it. So, and we know that 9 patients out of 10 again, I should not use the, word of patients. This is the clients. This is me and you. 9 of 10 of those who suffered from chronic kidney disease, they are asymptomatic at the earliest stages. They're like me and you. They have the same diet that we have together, and they have the same activity that we have together. So, how do you think that we can recognize them? This is the part that evaluation or a screening test or checkup is going to, highlight it here. Many people sitting there, and if you ask them, have you been sick? They're going to say, I never been sick. And imagine that. This is the things that I'm hearing my daily basis. The people coming to my clinic, and they're really at the age of, like 45 or not too late, not too old. And when I'm asking them, hey, your kidney is terrible, like, he said, oh, nobody told me that. And I say, okay, when was the last time that you check a blood test? He said, it was 15 years ago. Like, okay, if you are not checking anything in a period of time, you may not showing, any evidence of the chronic kidney disease at first. This is another amazing things that, I really need to discuss. 1 in 3 adults with diabetes and 1 in 5 adults with hypertension, they definitely may get the chronic kidney disease. Do you know anybody around you or your family that doesn't have diabetes or hypertension? My mom is diabetic. Can you even find any family around these days without diabetes and hypertension? And look at the numbers. This is not combination the numbers for the people who has diabetes and hypertension together. It's only if somebody has diabetes, which is much more prone to get the kidney disease, and hypertension, which, is going to be a second line for causing the chronic kidney disease. But how many people we have under this umbrella of the diabetes and hypertension? So this is a very simple picture, but this area that I'm showing to you, the reason that I put everything over, I just wanted to mention that 2/3 of the whole population in United States that is currently under dialysis, 2/3, they have diabetes or hypertension. And this is actually the causing of their end-stage renal disease being on dialysis. This is the same words that I just told you, and I just, write it there as a facts, which is really important on, patient with the chronic kidney disease. But again, the most important things for us to recognize it before it cause damage to the kidney, end up with dialysis. And this is the things that I really want every one of you, if has any physician, ask them to check the urine and make sure that they check the protein or blood in the urine. This is very simple test. And I know that our people on TKF, we did a lot of, this type of things. And we found out a lot of people who think that they're really good and healthy, they actually have some damage on their kidneys, just with simple test of the urine. So what this graph is going to tell us, this is going to tell us about CKD. CKD stands for chronic kidney disease, okay, which means that the people who chronically have a kidney problem. But look at here. What is the age which is much more highlighted at the, chronic kidney disease? 65 and above. The age that they are under retirement, they need to enjoy their life. And right now, they are at the level that they need to get involved with the chronic kidney disease. The other amazing things on this statistics, ladies get more chronic kidney disease, end up with dialysis compared male. What do you think it is? What's the reason, do you think? Because they're much more hard worker and they are not having the access to the clinics or, showing themselves up for the raise their hands and say, hey, I need to check up. And the next important things is look at the percentage of the population that they have a chronic kidney disease in the whole United States. What is highlighted here? And there is a reason for all of those. There is a reason for all of those, which we recently find out a lot of genes, which is only in African American, can proceed them to chronic kidney disease and end-stage renal disease. This is a new medicine. This is the type of the medicine that we like, that and you understand that check the genes is not the bad things. We can find out the things ahead of time for the people. And the second things, we know if they're transferring to the another generation. It's very important to know, right? And this is the way that we can screen them much more quicker and do the right treatment for them earlier than later. Again, this is like all the things that I just showed with your picture. I just write it down for whoever you're gonna, read it and do it there. And the main important things that I just discussed with you was this bottom line: age of 65, ladies, and African American ethnicity. So, what's the another things which important for us? Let's look at our country now, our beloved country of United States of America, that what we are doing between all the countries around. So if you are at the good level or bad, what do you think we are in? With all the money that we spend on the Medicare, which is amazing, I'm going to tell you about that, which is actually equal of like half of the other countries in whole world. The money that was spent on the Medicare for, American citizen there. But look at here. Oh, I'm sorry. But look at here. We are actually, we're on the first worst countries regarding renal kidney disease and end-stage renal disease. This is unfortunate, but our system is not a system to pick up the patient. Like the countries, like, you see over here, like Sweden, Finland, they may have the same prevalence, especially in the white population with us. But why they're much better than us? Why is that? Because they have a affordable healthcare for everyone. I remember Barack Obama said that many times and, never can get through it. And they check up the people at the age of 30 to 35. It doesn't matter if they want it or not, because it doesn't have any burden of the money or expense or insurance or anything like that. That's why they're doing much better than us. So what we do in our Tennessee here, in terms of, other states in the United States, where we are at, I need to, young fellows ask, this is our Tennessee here. We see that a lot of states is much worse than us, right? Why do you think they are worse than us? Anyone? Can you tell me why Florida, Texas, and the area of the California and all of those, we have much more chronic kidney disease patient? This is because of the population of different ethnicity over there. This is the reason that we have more of those disease there. And we are actually here, like, with the things there. We are not best. White and gray is the best, and whatever darker is the worst. So I'm pretty sure Susan is going to talk to you about that better and more than me, but this is the way that, I want to just telling you what is important. This is a determination of health. And I wanted to tell you, health is not only doctors and pharmacy. Health is combination of many things, which is top of that is nutrition, activity, emotional things, and make sure that you follow up. This is all just saying like that. Because many people, when you're telling them, like I have a people that coming to my clinic and I say, okay, can you tell me what's wrong with you? And they say, hey, you are a doctor. You need to tell me what's wrong with me. They say, I'm sorry. We need to back up a little bit. Like you need to know yourself first, then I can help you on that. Because we are all tools. We are not really the people that can, make a miracle there. But we have a knowledge, we have a statistics together, and we know what we need to do. But if we have a person that doesn't know anything about herself or himself, it's so difficult to manage them. Let me tell you that. Again, this is the same things that I told you about that. But one of the highlighted things that I wanted to tell you about is the social determinants of health, educational issues, and environmental exposure, which all goes to socio-economic things, which how much they're important are someone to get the through the healthy life and healthy system. Look at here. This is I really like that when I prepare my presentation for you. This is a very simple graph, but what is telling us? This is factors related to health and well-being. This isn't general things. This is not only talking about the kidney. But look at here. Genetics is a very big part of that, right? But what is then more than genetics that really, really is affecting us? This is the things that we need to change. This is the things that we really need to work on it. And genetics is another new part that we are going to get the help of the companies that is sitting outside there and telling you just swab around your buckle and send it to the lab with no expense to you. And they're going to tell you, hey, if you have a bad genes to cause you the problem. But the bigger, iceberg here is individual choices and behaviors. Because the people doesn't believe that they should check up before they get sick. Because they don't believe that they may get sick by the age of 25. They don't believe that they're from a family that they may have a hypertension and diabetes and they may transfer to them. This is the things that we need to change, and I hope that you get my message from today's presentation. So this is maybe my last talk is about the Medicare spending. So that's why I told you in the United States, we are spend a lot of money. But look at here, we just wanted to talk about the chronic kidney disease. Chronic kidney disease, not including interstitial disease, which is a people on dialysis. At the age of 66 or older, exceeds $75 billion in the year of 2020. With the inflation now, I'm telling you, this is much more than that for this year, okay? And Medicare-related spending for beneficiaries of the end-stage renal disease patient who is on dialysis, it's more than $50.8 billion in 2020. But more important than that, the people who has a Medicare and they don't have any diabetes or hypertension, their expense is like a half of the people who has this CKD with combination of diabetes and hypertension. Which means we really need to work on prevention now. This is the time, because when we get to the, many of our people here, they're really young. They're still not at the age of, 60. But, maybe the Medicare doesn't have any money to spend for us anymore. So this is another scary things. This is my references just for you, that telling you where I get my information from, that if you have any question or need more information that I can provide for you. I know that you're going to ask your question. Please let me know after our panel, done with their discussion. I'm at your service to answer any of your question. Thank you so much for listening to me, and I hope that we learned something together today.
Hi, everyone. Thank you so much for having me. I am so grateful to be here, really thankful for all of you for inviting me, and really excited to learn from this wonderful panel as well. Really nice to meet Susan for the first time today, and Nader I've known for years now, and we are collaborators in research as well. So it's really wonderful to be here. My name is Devika. I am a nephrologist at Vanderbilt, and I'm really passionate about improving health outcomes among all people living with kidney disease. So I actually don't have slides for you today, but I did want to focus on some things as a complement to Dr. Bari's presentation. So Dr. Bari did a wonderful job focusing on early detection, the importance of awareness, and understanding that many people are actually at risk for kidney disease who otherwise may not have realized it, right? Just as he said, we know so many people with high blood pressure, with diabetes, we may be living with these conditions ourselves. And yes, unfortunately, we do know that that places us at greater risk for developing kidney disease in our lifetime. Knowing that, what I wanted to focus on are what does life look like for somebody who has already been diagnosed with kidney disease? What comes next? What happens when you receive that diagnosis? How do you feel? What are some things that you need to do to really, really set yourself up for the best health outcomes and to prevent ever seeing a dialysis machine in your lifetime? Because even though I'm a nephrologist, Dr. Bari's a nephrologist, we all care for people with kidney disease. Our priority is to keep people off of dialysis. We do not like to prescribe dialysis. It is something that, should really be a never event, but sometimes it does happen. It is a great life-saving therapy that has a very specific role that really should be a bridge to transplantation and really should not be a new way of life for somebody, but unfortunately, sometimes it turns out that way. So when someone is diagnosed with kidney disease, it often occurs depending on the amount of care they have received ahead of that time. It's often a surprise because, as Dr. Bari said, this disease is asymptomatic until it's very advanced. People will not have any changes in their urine output quantity or quality. People will not have any particular symptoms they can pinpoint to. Maybe they've had some more recent difficult to control blood pressures. Maybe they've had some more recent difficult to control blood sugars, but it is really a laboratory diagnosis that you get from either your primary care provider who may have referred you to a kidney disease provider. So several of my patients who might not have received the length of care prior to that time that they truly deserve are surprised. They're really shocked. They, often tell me, gosh, like, why didn't anyone tell me this before? Or no, IP fine. I hear that all the time, IP fine. Like, yeah, unfortunately, luckily we caught it at this stage, but, your lab results do tell me that your body is having a difficult time clearing itself of toxins. So there's a specific lab value that we check that kind of gives us a hint that something's going wrong. Again, you will not feel any different. And we also look at your urine, and sometimes we see under the microscope that there's protein in the urine. To you, your urine will look exactly how it always does. So again, just highlighting the importance of what Dr. Bari said, which is that early diagnosis is really the best thing you can do. So when you receive the diagnosis, it can sometimes feel like it's a bit of a shock or surprise. There are many things that can be done that can prevent dialysis. There is hope. So if you or your family member receives a diagnosis of kidney disease, that is absolutely not the end of the world. There are many things that can be done to delay kidney disease progression. In the past, when I was earlier in my medical training, we had fewer drug therapies that could do this. Now that's not the case. There are drugs that we initially thought were only good for people with diabetes that now we know they actually prevent dialysis initiation. So ask your doctor if you have kidney disease or if you have a loved one living with kidney disease, you can inquire about, your doctor will know which ones you're talking about. There's specific medications for diabetes. Januvia is an example, that's the brand name, but they actually also slow CKD progression. So there are specific medications that are helpful. The other thing I want to share with you is treating the underlying cause of your kidney disease is the best way to prevent dialysis. If you have kidney disease from diabetes, what do you need to do differently to take care of your kidneys? Take care of your diabetes. Really nothing else. If you have kidney disease from high blood pressure, what do you need to do to stay off dialysis? Take your blood pressure pills, try to eat less salt, eat a diet high in potassium, and that will keep you off of dialysis. Certainly, there might be other factors that work against you, but the number one priority is to treat the underlying cause of your kidney disease as a means to stop dialysis. Third, the kidneys are just like the heart. They have a lot of shared mechanisms that inform what occurs to them in terms of their progression and their disease progression. So anything that's good for your heart is also good for your kidneys. Every time your heart beats, 25% of that blood flow goes to your kidneys. So having a healthy heart is directly related to having healthy kidneys. So what does that mean? What are some things that are good for heart disease? Moving around every day. Not just doing aerobic activity, but sometimes maybe doing some resistance against your muscles, lifting some weights, nothing crazy, but just staying active. Again, eating a healthy diet that isn't very high in sodium or processed foods, and taking your medications. So all of those things are exactly what you would do, that these healthy lifestyle behaviors that are really good to prevent cardiovascular disease. Well, guess what? All of those things will also prevent further kidney disease progression. So number one, might be a shock when the diagnosis initially comes, especially if you haven't had great access to care, because it might be asymptomatic most likely. Two, there is hope after you potentially get this diagnosis. Doing whatever you need to do to take care of your other medical conditions, particularly your heart, is exactly how you prevent kidney disease, except for a couple areas that deserve special attention. So that's also what I wanted to kind of share with you. What we do know now, in the last 5 or 10 years, we've learned in research that for many reasons, having kidney disease can predispose you to cognitive decline and physical function decline. There is a little bit slighter increased risk for that. Once again, what does that mean for you or your loved one who might receive a kidney disease diagnosis? Things that improve your brain health, things that improve your physical function are basically the same things that you do to take care of your heart. So once again, not to sound like a broken record, but anything you can do to lead a physically active, heart-healthy lifestyle, stop smoking, all of those things that your doctor tells you to do to take care of your heart is extra important to take care of your kidneys and also to prevent complications like potential cognitive decline and muscle wasting that we are seeing can occur. So doing all of those things is very instrumental to staying off of dialysis. We are here to partner with you to make sure that you have the motivation, empowerment, and support and education and knowledge to achieve those goals. That is very, very important to all of us on this panel, and hopefully important to all the providers that care for you as well. Say you do all of those things, and for whatever reason, your doctor says, okay, you know what, your kidneys are still looking a little worse. You might also start to feel at this stage certain symptoms that now tell you, oh, those toxins are building up in my body. My kidneys aren't able to get rid of them as much. Most people don't know the symptoms of kidney failure, including patients that I, still see in clinic. But they are a combination of some nausea, low appetite, real bad fatigue, sometimes some itchy skin, People will tell me that food they eat has started tasting different, kind of metallic. Sometimes they'll have hiccups, kind of just like, kind of starts as like a GI unease. And that'll happen over usually a few weeks. And when I have someone that I'm caring for in my kidney disease clinic that starts telling me, oh, you know what, doc, my food doesn't taste as good anymore. And I also don't even feel like eating as much anymore. Those are all clues in conjunction with some lab values that tell me, okay, now we might have to actually talk about things like dialysis. Just as I told you that a diagnosis of kidney disease isn't the end of the road, being told that you might need dialysis to live should not be seen as the end of the road. It's not ideal. By no means is it an ideal thing to be told, but there are ways to make it more suitable with your lifestyle. There's ways to dialyze at home. There's ways to do it through your belly instead of through your arm. And it is the responsibility of us as providers to kind of, if you're at that stage, to do the best we can to give you all the education about all the different modalities and the different options you have that are complementary to your lifestyle, such that you can still do the things you love doing and see the people you love seeing, even though you might also be receiving dialysis. You should absolutely still be eligible for a transplant. You should ask about transplant eligibility. How can I get on the list? How can I educate my family to be evaluated to potentially donate to me? All of these things should all occur at the same time. Let dialysis be hopefully something that no one ever does, but if it is, just something that's temporary until a transplant. And the last thing I'll say is dialysis isn't for everyone. If you happen to be particularly advanced in age, I had to make this decision for my own grandmother last year, who's no longer alive. She went into renal failure actually from COVID. And the physician started talking to me about, starting her on dialysis. And, she was at that time at a very different stage in her life. Again, let dialysis be a bridge to something better, not a new way of life that potentially limits you. My grandmother was 89. She had been very physically active and had led a full life up until that time. Had she been started on dialysis, I knew that she would never come off. I knew that that was not, a life that she would have wanted to lead. She had made those wishes clear prior to this occurring, and I knew that about her. So even though her kidneys truly were failing, and yes, maybe it would have given her, a few more months, but it was not a bridge to transplant. It was not a bridge to better quality of life. And we, as a family and, with her blessing, elected to not pursue dialysis. So I've kind of painted different scenarios because they're important for you to hear about, even though they might not affect you. They might affect someone you care about, friend or loved one. And that is that kidney disease can be a serious diagnosis, but it should not be the end of the road for anybody. Hopefully you are all privileged to find a provider that cares about keeping you off of dialysis. It is not something we like to prescribe. If you find yourself or a loved one on dialysis, stay very, very active about transplant knowledge, awareness, education, and getting on that transplant list. And finally, if you're particularly advanced in age or your loved one is very advanced in age, it's okay to actually say no to dialysis. It is a choice. So hopefully some of that was helpful and got you thinking about some things that maybe you don't normally think about. And once again, so happy to be here, grateful to be here, privileged to be here, and really we'll be happy to answer any questions at the end. Thanks, everyone.
You know how you guys get that feeling where everything just kind of feels right? You're supposed to be exactly where you're supposed to be. Like that's how I'm feeling right now. Listening to Dr. Nair and Dr. Bari, I feel like I'm here for a reason. I hope that however we're empowering you to help someone, if not yourself, with what you're learning today. Just a full disclosure, if you see under my name, Susan Zaghi, Calliditas, I do work for our pharmaceutical company. Today, there's no affiliation with that, but I did just want to put it out there. I work with patients who also have kidney disease, but a rare form that comes from IgA nephropathy. So if anyone does have IgA nephropathy and want to learn more, just feel free to come and speak to me at the end of the presentation. So this is probably, I'm giving you guys a short version of what a renal diet should look like. I'm going to try to make it as enjoyable as possible for you. But there were a couple things that Dr. Nair and Dr. Bari said. And I think it was Dr. Bari who said, know yourself first. Be your own advocate, right? My husband tells me all the time, you're your biggest fan. Absolutely, I am. I'm going to be my biggest fan because there's no one else really looking out for me but me. So the more you educate yourself, the more tools you have to empower yourself. And just as Dr. Bari said, doctors are tools. Dietitians are tools. We're all tools that you get to use any way that you want and to empower yourself and to be your own advocate. I always tell I'm a mom of 2 toddlers, and I tell my husband this all the time. Your health is your wealth. Without it here, we don't have anything, right? So, there it is. Okay, so as you guys know, I have written cookbooks. The reason I've worked in dialysis and CKD for about 20 years, and it was when I was working with patients in dialysis that empowered me to write books about kidney disease and diet. And just as Dr. Nair said, kidney disease is special. It's not the best thing to have, but there are ways to do it. And if you empower yourself to want to make those changes, you will dictate your future. And that's why I wrote these books, is to help patients with kidney disease to be better, to be more knowledgeable. So these are some objectives that I usually go with my patients if there's something that they want to learn about. I think we should learn more about protein, phosphorus, potassium, and just those 3 things a little bit today. Again, I'm really putting a whole, a lot into a presentation about it. So if you have questions, just let me know. So what is a renal diet? Does anybody know what a renal diet is? What does it consist of? Low protein. Got to watch your phosphorus. Low potassium. Gosh, I'm running out of stuff to eat, right? What else? What is it? Yeah, you can pretty... You said it all. So, but here's the thing with kidney disease, is that and take this the way I say it, every body is different, right? It depends on what your labs look like, what your story is, and what it may work for one person may not necessarily work for someone else. So just keep that in mind. Yes, a low protein, but it depends also on what stage of CKD you're at. It could be low protein. It could be medium protein. If your albumin is really low on dialysis, that means we got to increase your protein. So it really varies on where you're at with your labs. So before I tell you what a kidney diet looks like, I do want to go over what an American diet should look like, right? So this is before anything else. A healthy American diet, we have these guidelines that are set. They're not just to be set for just anything. These are guidelines for myself, for everyone really. And it consists of fruits, vegetables, whole grains, lean meats for a reason, right? So we want to try to live a long, healthy life by eating these variety of foods. These aren't guidelines that we just came up with. So when you have kidney disease and you're talking to me, I can't begin how many times patients tell me, oh, I can't eat anything. I can't eat fast food. I can't eat soda. I can't drink soda. I can't do this. You really couldn't eat. You couldn't really do that a whole lot before you had kidney disease, right? Because we want to encourage you to get those antioxidants and those lean meats and whole grains. There's a reason we want your fiber intake to be high. So when you have kidney disease and you're going to tell me, oh, I can't have this, I can't have that, you couldn't have it before. Now we just want to limit it and do some certain things differently. So this here, what it says is that with kidney disease, the higher intakes of processed meats, especially red and processed meat, may increase your risk of developing CKD. That's why if you go back to my other slide, we want to reduce that and part of an American diet for a reason. It's to reduce your risk of hypertension, reduce your risk of diabetes. So a healthier diet with less sodium and higher potassium when you have CKD can actually reduce your risk of overall mortality and possibly do not get to dialysis. I have patients that are still stuck at stage 2, stage 3 for maybe like 10 years that I consult with still. So there, you can, if you have stage 1, 2, or 3, you can sustain that as long as you're doing everything to help sustain that, if that makes sense. So here's what 2,000 calories look like, right? So these are, again, based on a diet with whole grains, fruits, vegetables, lean meats, less processed foods, and so forth. And I'm going to go into a little bit of those in a little bit. So what counts as an equivalent? What counts? So for fruit, we're supposed to have about 2, right? So that's 1 cup. That's 1 cup. I say portion control is everything. For fruit, you can have either 1 cup of raw or cooked fruit, or 1 cup of juice, that's 1 cup of equivalent. So it's all about how much you eat, right? And they did a study a few years ago, they called it the popcorn study, right? So they gave these patients a big tub of popcorn. One of them were stale, and one of them, they were both like these, the movie bucket-sized popcorn buckets? They gave each one a big one with stale popcorn, and the other one was a little bit smaller with more fresh popcorn. Which group do you think ate a lot more popcorn? The stale. So they ate stale popcorn just because the portion size was bigger, right? So they ate more. That's the problem I think we have in this American diet, is that not everything is better when it's bigger. So let me just go here. Okay. So when you're talking about phosphorus, there's 2 types of phosphorus, right? When you have kidney disease, you want to look at organic phosphorus and non-organic phosphorus. Does anyone want to take a guess on what the difference is? What does organic mean? Natural, right. So organic is natural phosphorus. So you have maybe cheese or milk, right? So non-organic is more of the additives. So anything that's been added not naturally into food. So the reason that we have these foods that sit on the shelf life for weeks at a time is because of additives. Is because they help to increase the shelf life of these foods, especially if they're packaged with cakes and cookies and chips, so forth like that. They help to keep them more fresh or longer anyways. So if you can't pronounce it on a food label, don't eat it. That's my rule of thumb when I talk to patients. If you can't pronounce it, don't eat it. And everything, like if you look at the non-organic, they're all trying to hide, right? So dicalcium phosphate, disodium phosphate, sodium polyphosphate, those things have a lot of phosphorus. And on top of that, you actually absorb almost 100% of that phosphate additives that come from the non-organic food sources. As opposed to the natural, you only absorb about 60 to 70%. So they stay in your bloodstream a lot longer when you eat foods that have a lot more additives in them. Look, I'm all about having a cheeseburger with French fries and a Diet Coke. I'm all for it, but I'm not going to do it every day. Moderation is key. So sodium. How much sodium do you think is allowed in part of the American diet? Anybody want to read that? What's the number up there? 20. Does anybody know what 2,300 milligrams of sodium looks like? This. 1 teaspoon. 1 teaspoon of salt is 2,300 milligrams of sodium. That's it. That's all we're supposed to be eating every day. How much do you think we consume? Throw out a number. About I would say about 7,000 to 8,000, so about 4 or 5 of these. That's how much salt. So when we talk about diabetes and we talk about hypertension, it's not like this isn't coming from anywhere. This is coming from what we are actually eating. So again, the more you know, the better you have the tools to make healthier decisions. So these are some food sources of sodium. So everything we're pretty much eating has sodium. Our fruits even, well, fruit juice have zero. Our snacks, our sweets, our condiments, ketchup, mustard, all those added things. Mayonnaise has salt. Yep. Look, I like my bag of chips. Those chips are awesome that are in our lunch today. I'm not bashing them. They're really good. We also need salt in our diet. We just don't need so much of salt. So again, tips for eating healthier or at least less sodium is read your nutrition label, right? People, this might come as a surprise to many of you. And again, I'm a big study person, so I like to look up studies. It's actually not more expensive if you cook at home versus eating out. McDonald's these days, okay, they're so expensive. I went to Chick-fil-A the other day with my 2 kids, and with my husband. My husband eats, he's an athlete. But again, it was like $45, $50 at Chick-fil-A. I mean, fast food, just because it's fast doesn't necessarily mean it's cheaper anymore. McDonald's is even getting more expensive. So the average cost to cook at home is less than $5 a meal versus eating out. It's $20 and some change to eat out per meal. And if you look, like lower sodium items may use potassium chloride. So sometimes when you have to worry about your salt, it's also in conjunction with potassium. So if you look here, here, tomato juice, canned 1 cup, has 680 milligrams of sodium. How many are you supposed to have a day? 2,300 milligrams. And then you also have potassium is 430. And again, it depends on what your potassium level is, which it could kind of have, like, I'll have a patient say to me, oh, my tomato juice has so much potassium. I look at her labs, your potassiums are running fine. Have some tomato juice, have some spaghetti sauce. It's okay. And then if you look at the turkey sausage here, it's got 446 milligrams sodium and then also over 1,000 milligrams of potassium. So sometimes when something's high in salt, it most likely also has potassium in it. This is the food label. Let me see here. And then these just next few slides just talk about portion sizes, right? So here let me go back here. So we're talking about dark green vegetables for 1,600, 2,000 calories, and 2,400 calories. These are how many portion sizes of green vegetables you're allowed a day. So 1 cup is equivalent to 1 cup raw or cooked vegetables. And then these, again, if you're monitoring your potassium content and you're not sure how much you're supposed to eat, this is a good tool here to tell you about portion sizes, certain cups. So now you know you're supposed to only have about 2 to 3 cups of vegetables per day. And broccoli, let's go through these. Okay. So also, does anybody know anything about blanching? Go ahead, what is it? Sorry, I can't hear you. Yes, exactly. So to reduce, like say you want potatoes, right? And they're high in potassium. So what you do, one method to reduce the potassium content is you cut the potato up, you peel it, you cut them up in small pieces, you put them in the water and boil them for about 10 to 15 minutes, and it actually leaks out some of the potassium content. So you can reduce some of your potassium content by simply doing small methods like this. Also, canned has less potassium than something that's more baked. And boiled, you don't ever want to really microwave your vegetables because it doesn't really make a whole big difference. And smaller pieces are better than larger pieces. Again, measure out. Use your tools. Another tool aside from a nephrologist and a dietitian is measuring cups. Use measuring cups, yes. So if you drain them and you let them sit a while too, that also reduces some of the salt content. So don't stop eating some of your favorite canned foods. And again, it depends on what your potassium or sodium level is. But if you have diabetes or blood pressure or hypertension, your number one goal is to keep the hypertension under control and your diabetes under control. So if something is too high or when in doubt, don't eat it then. Yes. Those are good too. That's a good alternative as well. Listen, I'd rather you have a frozen bag of broccoli than a bag of chips. I mean, truth be told, I'd rather you have, when I make chicken pot pie or if I'm making certain dinners, I will use frozen fruits and vegetables all the time. All the time. And again, if you measure them out, a cup of frozen vegetable is the same as a cup of fresh vegetables. So it's the same thing. And then this again, just choose lower potassium foods. Buy frozen vegetables without added sauces or seasonings. Listen, I get it. I totally understand. I've worked with those different types of population, but I also feel there is so many tools out there that we can utilize as clinicians. And the WIC program is another program. There's a lot of programs like that will help. When I worked in dialysis, we had programs, the home deliveries. So if you go, and I can share the website with you, but there's actually websites, especially for those patient population. Because I worked in dialysis up in Pennsylvania. So I worked with a lot of low income families as well. So there's actually home delivery meals. Let's say they can't get to a grocery store. They're subsidized programs that if they sign up for and they qualify, they will get delivery meals to them. There's so many different options. Yes. How do
healthy. I grew up in Montgomery, Alabama, on country food in the country.
Sure.
I have never had to. I eat anything I want, whatever I want. I kind of eat in moderation, but I don't just sit and think, oh, I can't have this in. I gotta make sure. I don't do none of that.
Yeah.
How do people develop that mindset,
That skill.
and knowledge? Is that something in more affluent families that's learned because it's practiced? What?
Listen.
I don't understand how people understand all this.
So this is what I went to school for, right? We don't expect you to understand all of it. I grew up in a low income. Heck, my family, we were on food stamps for many years. I was on my own. I was 16. I had to learn, right? So it's like when we're learning and educating ourselves, that's when we learn. Rule of thumb, just basics here. Again, this is a topic I can talk about all day with, but just the basics, the more colorful your plate is, the better. The more active you are, the better. It's also not just about numbers, right? It's about how you feel. It's about how you feel from inside. Like for me, it takes about 30 days to form a healthy habit. If you stick to something, doing it for 30 days, I guarantee you will start building small. It's not going to happen overnight. Rome wasn't built in a day. I tell all my patients, baby steps. If you have diabetes going on, you have hypertension, you want to lose weight, focus on one thing. And then everything else will kind of work on its own. If you want to get more fiber, I guarantee you, if your goal is to eat more fiber, you're not eating chips. You're not drinking soda. Focus on that because average American a woman needs about 25 to 35 grams of fiber every single day. If you focus just on that number, I guarantee you're going to be eating a lot healthier without even knowing that you're eating healthier. So just take something and make it your own. Does that make sense? You don't have to know everything and anything, right? This is why we're the tools for you. But there's something about education that the more you know, the more you know. And the less you know, what you don't know what you don't know. All right, let's go here. So speaking of fiber. So these are all, fruits and vegetables and so forth. Let's see. Whole grains. This is the fiber part, right? I mean, average American, they don't eat enough fiber because if they did, we'd be living a little healthier. Average American, a woman definitely gets about 8 grams of fiber every day, and we're supposed to be consuming 25 to 35. That's a woman. Male are from 35 to about 40. And most breads, they do have phosphorus in them. They have to be careful, or potassium. So if you look here, most bread has salt. That's how, we can't hide that. Most breads have salt. Phosphorus in whole grain. Yeast bread may be more bioavailable. So if you look here, the white bread here is very, very high in sodium. So it's not so high in phosphorus and potassium. But if you're looking to reduce, if you want to reduce, all of these have sodium. You can't get past it. But I would say maybe do the white no salt or white bread here. Maybe here the oatmeal is healthier. So again, there's different options to it. It doesn't have to be, again, if I can't look at your labs, like this is the beautiful thing with CKD is no person is the same. Like everyone's labs are different. So it depends where you're at that point that give you guidance. And you don't even have to have kidney disease to know that this is important as well. Okay. So here, these are the cold cereal, always better, or cornflakes are low in salt, puffed rice. The worst would be like the bran or the wheat flakes and so forth like that. Those are always the higher. And again, depends on what stage of CKD you have. There we go. Protein. So your body needs protein, right? We all need protein to help build muscle, repair tissue, fight infection. So the amount of protein really depends on your body size, your kidney problem, the amount of protein in your urine. I know that average American consumes a lot of protein because they consume a lot of red meat. So we know that protein is usually not an issue in the American diet. But when you have kidney disease, you have to limit, depending on what stage you're at, you have to limit your intake. This is animal protein versus plant protein. Look, I'm not a vegetarian. I love my chicken. I love my steak. I love my fish. Yes, there's been studies that a plant-based diet may reduce your risk of lower mortality in CKD. I'm not saying that you all have to be a vegetarian to get the benefits. You can eat what you enjoy, but do a healthier options in a more realistic portion sizes. Let me ask you another question. Does anybody know what 3 ounces of meat looks like? Oh, there you go. There. This is 3 ounces of meat. This is 3 ounces of meat. This is what you're supposed to have at least 1 or 2 meals each day. That's it. How much do you think the American diet? More than that, almost like 4 sizes of this, 9 to 12 ounces per meal. So again, education, the more you know, the better. So high protein diets are not recommended for people with CKD. Again, take that with a grain of salt because it really depends on what stage of CKD you're at. Most Americans eat more protein, averaging 1.2 to 1.4 grams per kilo. So if you take your weight in half and you want to just minimum, if you want to take your weight in half, divided by 2.2 to get your weight in kilograms, and then multiply that by 0.8, that's what the average American should be consuming of meat if you're living a sedentary life, not exercising, not anything. Let's see. Okay. So these are just the summary slides. For your salt intake, I always say read your food label. Sodium content is always listed. Use fresh rather than packaged meat. Use fresh fruits, frozen, canned vegetables and produce. Avoid processed foods. Again, I like processed foods. I'm not telling you to not eat it at all, but cut your intake down. Cook at home and do not add salt. So there's a marketing scheme to food grocery stores. I don't know if you guys know this, but you know how like the most common things you want to go when you go to Kroger's is to get milk and bread? Where are usually the milk and bread? All the way in the back. So there's a marketing scheme to how you walk into a grocery store. So the next time you're walking to a grocery store, you're going to think of me. You're like, Susan told me this. And honestly, when you go, keeping on the outside is better because then you have all your fruits and vegetables, your whole grains, your milk, your dairy. Everything on the inside is a lot more processed, more additives. Yes. So almond milk, I actually included a recipe with you guys. Did they get that yet? Yeah. So it's a rice milk and it's actually really good for patients with kidney disease. Almond milk, that's what I use. I actually use oat milk versus almond milk, but it really depends. Again, if your phosphorus is running really high, I would prefer almond milk over regular milk. It really depends. I mean, I love almond and oat milk. I think they're healthier options. And it's a plant as well. Go ahead.
When you say monitor your sodium intake, is there an app where you can keep?
Oh my goodness, there's so many apps. There's a free one that's called My Fitness app. There's another one that's called, and what I'll do, Ria, is I can actually get a list of apps for you guys that cost nothing. They're free, and you can even go to the store, scan that food item, and everything will be right there, and you can just tell exactly how much of that portion size you had, and you can calculate it. That's a great way to honestly, if you want to monitor and you want to watch everything that you eat, MyFitness app is one of the best ones I've used. And then phosphorus, we talked about that. And then just a brief summary. Look, healthy eating patterns may not just be beneficial to patients with CKD, but for all of us, right? Yes, go ahead. Oh, okay. An egg is an egg. So but listen, brown eggs are actually a lot more expensive than white eggs too. So if you want to get more for your bucks, eggs, when you have kidney disease and you want to get protein, it's the way that the chickens are raised on the farm. But the best form of protein that you can get in part of your diet is actually an egg. It's called the HBV, high biological value. Eggs are really good for protein. But to me, if I'm talking to patients that have CKD and they came to me and they said, which is better, a brown egg or a white egg? I would say it's whatever eggs you can get your hands on, to be honest with you. It's just a way that it's raised, and both have about 6-7 grams of protein per egg. Okay, so this is where you can find me. If you have questions, I am on social media, on Instagram. I left my email if you guys have any specific questions. And yes. 3,500. So 3,500. That's why it's easier to gain weight versus losing weight. So she asked, how many calories do you need to consume to gain 1 pound of fat? And that's 3,500. Yeah, so that's why it's so easy to gain weight, right? Because we're so not mindful of what we're eating, but it's a lot harder to lose that weight. Yes. Okay. Well, we can talk about that because, again, I can go into that. So listen, we have toddlers. She has an 18-month-old. I have a soon-to-be 2-year-old. It's hard, right? But we also have to acknowledge that as we get older and as we have kids, like, our body changes. So you have to do things differently. You can't keep doing what you're doing to get the same result. Like, for me, I know what I have to do to get that 6-pack, and I just don't want to do it. It's a lot of work. Yes. Yeah, I hear you. I know. Yes. We're never going to let go of these eggs. How about I put that in the end so we can leave questions for the panel? I'll get you guys an answer. A white egg versus a brown egg versus egg beaters. Okay. Oh, egg whites. Okay. I'll get the whole egg. It'll be egglicious. Thank you, guys. I'm very honored to be here. Thank you for your time.
Guys, thank you so much. I am so excited and charged up that when I get home, I'm throwing out all of my Halloween candy. It's gone. But at any rate, can we give them another round of applause? Dr. Nader, Dr. Nair, and Susan Zygup, thank you guys so much. The information you guys have shared is just amazing. We've got quite a few questions out, but I want to take a minute in case somebody, show your hand if you have an additional question that you'd like to ask. So we have one over there. Okay,
as
so we do have a
it's
few
not
questions.
An egg question.
Okay, we're going to take a minute just to ask a few more questions. I'll come over to you and give you an opportunity to do that. Also, a couple of other things I want to mention. Again, the whole premise behind what we're doing is to share knowledge. As Susan said, knowledge is critical. Knowledge is power. The more you know, the more you know and the more you grow. So we want to make sure that we are consuming knowledge that's going to help us improve our lifestyles. So one of the things immediately following here is we're going to have some screenings. Please, please, please go in there and get a screening. I always say it's like playing chess. You know, when you know where you stand, you can make your next best move. So when you go in there and get a screening, you're going to know what your numbers are, and then that's going to dictate your next step. So please make sure you go in there and get a screening. Tennessee Kidney Foundation, they're all set up. The surgical clinic, they're all set up. Another thing, there is a survey on your table. Just a one-pager, quick survey. If you can just take a few minutes to do that while I'm going around and asking a few questions, that would be great too. Or when you're asking a few questions to our panelists, that would be great too. Also, we've got Natera out there. Be sure to see them. And then we also have a Tennessee Kidney Foundation table with a lot of goodies out there. So I'm just going to come around and ask. Let you ask a couple of more questions. We're going to be brief, so we're going to take up too much of their time. And then we'll get started with our screenings and anything additional. Okay? So raise your hand if you have a question. Karen, I think this is your 8th question. Okay. Okay. So Karen's question is, having high blood pressure are what now? Ions? In terms of?
Having high blood pressure. Are long-term use of statins more likely to lead to kidney disease?
Did you guys hear that? Okay, is high blood pressure or having statins can lead to kidney disease issues? So maybe Dr. Nair, Dr. Bari.
So what the question, Karen, was, is being on a
our long-term use
of
of
statins
statins, which yes,
associated with kidney disease? In a short answer, no. Curious as to curious as to why you thought that maybe something's out there that we should know about, because we should dispel that. Because remember, the best way to protect your kidneys is to do things that are good for your heart, eating well, moving your body, taking your medications, which oftentimes will include a statin if you have high cholesterol. So there's actually also pretty well conducted studies that show that people with kidney disease who were on statins had far better health outcomes, including mortality, just from the statin alone. So definitely be on the statin if you need to be on one.
Okay.
Good question.
Say your name.
Good afternoon. My name is Samantha A.G. I'm one of the nurses with one of the organizations next door that will be helping you out with the screening. I have a comment more so than a question. And my comment is, we are providing great information and great knowledge for you. But one of the key things that I think every presenter touched on was using your resources, which means going to your doctor, getting your checkup, getting your numbers, knowing your numbers. So you know the information is out there. We encourage you to go and get those checkups, but we also encourage you to tell at least one person. Tell a friend, tell a family member to go and get their checkup. Okay, so we just want to encourage you to do that. And then I will see you next door, but I wanted to say my comment before I ran next door. Thank you so very much.
Thank you.
Did you stand up? Just say your name.
Hello, I'm Tarina. I am a vegetarian and I struggle with incorporating protein and fiber in my diet. So I just like some suggestions. I do beans and legumes, but I'm wondering if there are any other items that I can incorporate.
What kind of vegetarian are you? Well, what are certain?
Fruits, vegetables, and seafood
So you do eat seafood.
once a week.
Okay. I'll talk to you offhand because I'll talk to you offhand. Thank you for that though.
My name is Nikki. So my question is, what advice do you guys have for someone who's trying to protect their kidney health, but they might be on meds? I know certain meds that have lithium can be harmful to the kidneys. What would your advice be on that?
You want to take that and I'll back you up?
Lithium is very old medication, actually. Okay. But We know that for some specific population, it works well and it should be there. But always remember that, to answer your question specifically about lithium, the kidney injury on that is really dose related. That's why it's very important for whoever get the lithium, make sure that the level is being checked and the level is adjusted. So this is the way that we know that the that complications after taking that is going to be less. The second important things is with any symptoms or even not symptomatic situation, they need to be follow up with someone who knows about the kidney and check the serial labs in a certain of the time to make sure it does not cause any damage to the kidney. So that this is really the main things is having a primary care physician and make sure that they are following with that, because like lithium is not a medication that's prescribed with primary care. Okay, this is the medication that needs subspecialty to start with, and I'm pretty sure whoever start with, they check those things ahead of time to make sure the kidney function is good, because this is under literature to do it, and they follow with primary care physician who is aware this person is on lithium to make sure that the side effects is not hurting the kidney.
I'll just add to that. And I should have said this earlier because a lot of my patients do ask me about it. There's no evidence that drinking any particular amount of water, particularly 8 glasses or how many ever, protects your kidneys. It doesn't do anything. In fact, there's actually a pretty well-conducted study that showed that people who were coached to drink 8 glasses of water a day had worsened kidney function, low sodium, et cetera, which can be a complication of lithium anyway. So don't worry about getting to a certain amount of water. It can actually potentially even cause harm. Drink when you're thirsty. In the summer, maybe drink a little more. Drink when you're thirsty. Other things that you can do to keep your kidneys healthy when you may be on some medications and might not have other risk factors are try to avoid any herbal supplements or things that are not prescribed by your physician that aren't like your basic multivitamin. Things that are not FDA regulated, we have no idea what's in them. I have had many patients who have gotten a diagnosis of kidney disease as a result of, unfortunately, some herbal supplements. And the last thing is, if you're in pain, headaches, back pain, whatever, some Tylenol and Advil is absolutely fine. I do worry about, I don't know if we get it in Tennessee. We saw it all the time in New Orleans, the Goodies powder and BC powder. Do you guys know where that is? What that is? Is that here too? Be careful with that because, you take it by the spoonful. You don't exactly know what's in particular packet or spoonful. It's very, very highly concentrated, and high quantities of that can hurt your intestines and your kidneys. So don't worry about getting to a high number of glasses of water. Drink when you're thirsty, but do avoid herbal supplements and things over the counter that aren't like a standard multivitamin.
We have another question here.
Hi, my name is Catherine. A few years ago, I had a misdiagnosis. I had a physical done, and the feedback was there was a lot of protein in my system. What does that mean in relation to what we think about when we're thinking of protein? What did that mean? And how severe would it have been had it been correct?
May I ask you a question, Catherine? Did I tell you this protein is in your urine?
Yes.
Okay. And just for my information, have you ever checked another time to show it's the same and accurate test?
Yes.
Okay. So look at here. I'm pretty sure that Devika is going to tell more advice maybe, but an intact kidney, even the best kidney ever in this world, it may have a little leak of the protein. Okay. So the amount of the protein in the urine is very important rather than they tell you, oh, you have a protein in there. This is not accurate statement to say. That's why when we talk about doing the screening from the professional of like TKF around here, is because they're gonna give us the amount that you have in your urine. We call it protein creatinine ratio, which is the things that we can find in the urine, and it's much more accurate of the test that you say, hey, you have protein. It really, for me as a specialist in this, it doesn't mean much, okay? Because some people, they just do it even at home. They do the test tape there and they say, oh, I have plus of protein, right? So, and it depends of the people and some people, they may not report it right. That's why I always say that. But always, if you have a protein, it needs to be checked with the quantitative, which means how much is there, okay? And if it's really about a certain number, it needs to be worked up, which means that there are a bunch of things needs to be done to make sure that this amount of protein is not for any other secondary reason. Sometimes even we need to do the biopsy of the kidney to figure it out why this kidney split the protein out, because protein is good stuff in blood, right? But when it goes to the kidney, it should not leak out of the kidney to the urine. And this is very important part, because many of the disease that is on the very early stage may cause that. And this is the time that we need to realize it to keep the kidney safe, because giving the protein a lot to the urine is going to damage the kidney in the long term. That's why it's very important. And I said that one sample of the urine for the people even above the age of 35 can be really, helpful to diagnose the kidney disease. So I'm not sure if I answered your question or not, but I just wanted to tell you, if anybody just, even it's an error, tell you that, hey, you have a protein in your urine, okay? Don't think this is, it's simple things. No, you need to get to the specialist and figure it out if this is right or this is an error, how much protein is there, then just follow with that. Because as I said, maybe this word keep you going for out of dialysis in future, get rid of the kidney failure, and have a healthy life.
Thank you.
You're welcome.
Thank you so much. Okay, we have time for maybe about one more question.
Just get it
someone over there.
repeated. If anyone gets
Let me
a
grab that.
positive urine screen for protein,
It's
I don't
right
know if
here.
that's included
Just
in
hang
the
on.
screenings today.
Yeah, just hold-
Definitely get it repeated. Protein should not be in the urine.
Okay, we have our final question. Get you to stand up and just give your name and ask your question.
Hi, my name is Shauna. I was wondering if you could explain a little bit about pre-diabetes and what it is and what it isn't. And I've read that you can reverse it, but not permanently. So a little bit about that.
I consider pre-diabetes depending on how long someone has it. And again, pre-diabetes just means that your A1C level hasn't reached a certain point where we diagnose you as having diabetes. So maybe it's, 6 instead of 2 different occasions of being 6.5 or above, or maybe you've just had one elevated blood sugar that was detected that was above the norm and you're not getting it repeatedly. I think, there is evidence that certain drugs can reverse it, metformin being one of them. Weight loss can improve it. There are ways that you can go from both pre-diabetes and diabetes to no diabetes. So they're both reversible. The important thing to think about pre-diabetes, though, is even someone with pre-diabetes for a long period of time can also have early kidney damage. Kidneys just don't do well with seeing a lot of sugar in the blood. It can really affect the different components of your kidney cells. So even pre-diabetes can damage your kidneys, particularly if you have it for longer. But both pre-diabetes and diabetes are reversible. Some of the end organ damage that can occur with both pre-diabetes and diabetes is less reversible, if that makes sense.
Okay, did you have something you want to add?
Well, just yeah, because I see a lot of my clients I call not patients, but they get it really simple. Like they come and say, do you have any diabetes? No, I don't. Like very sit. Then I have pre-diabetes. But let me tell you, if you have pre-diabetes and you're not being, following, it means you have diabetes. Why I'm saying that? Because many people with pre-diabetes in later age, they're gonna get diabetes. Okay. So the pre-diabetes is a kind of flag to just tell you, hey, you need to change lifestyle. You need to start working now to postpone the type of diabetes because some people have the genes. We talk about that, right? That these genes gonna let them to have the diabetes in the later of the age. So if anybody here heard that they have a pre-diabetes and not doing much, not having the diet, I'm going to tell them they have a diabetes now. Like, yeah, this is very important. That's why prevention should be important than treatment, okay? Because pre-diabetes, you can start the things and do the lifestyle changes, and you never get diabetes for rest of life. You see how it's important? Because if you get the diabetes, the risk of the kidney disease is 10 times than normal population. And it's just the one line, it's like a gray line there. But if you change the lifestyle, lose weight, daily exercise, diet, you may not even get to that part. So just, for everyone, because I know a lot of people, they're so resistant to accept that they have diabetes and they do diabetes, but they said, no, we have pre-diabetes. Like, okay, nothing to do. Like, you're good.
Be your own advocate. If someone told me that I took a test and I'm precancerous, I'm going to go do everything in my power to get that fixed or to go see what's going on. So be your own advocate.
Hi, I'm Rhea Kennard, founder of the Dorothy Marie Kennard Foundation, and thank you for joining us today. I hope the information that was shared by our esteemed panelists will help you get answers to questions that will help improve your lifestyle. Thank you for joining us, and see you next time.